Hey, you guys, this is Karie Johnson with Life Network and Ben Greenfield Life, and I am so excited. We are here at the Health Optimization Summit in London, England. We are sitting down with the top wellness leaders, biohackers, longevity experts, and we're going to go deep as in 15-minute conversations as fast as we can to learn why they do what they do, the top products and innovations on the market. So let's do it. 15 minutes, hot takes. Let's go. All right, welcome back. We are here, Health Optimization Summit, London, and we have Dr. Goran.
Yes,
and biological dentist here. And Dr. Goran, can you please tell us, specifically what the difference between a regular dentist and a biological dentist? Why should we go to someone like you?
Honestly, I don't want to actually make a difference between these two.
Okay.
I think they should be the same.
Okay, that's a good point.
I think every dentist should have the idea of dentistry is connected to the body.
It should not be separate.
And let's go to the similarities, because sometimes when you talk about the differences, you create a clash.
Okay, good point.
Now, the similarity is that even conventional dentists are saying that the bacteria has an influence of cardiovascular disease, dementia, Alzheimer's, those things are connected. Right. What I find is that a biological dentist, because of his interest in health, he actually makes more emphasis on, yes, I really want to look at your periodontal side. Mm-hmm. I really want to look at your root canals. I really want to assess, do you have any chronic inflammation hidden somewhere where somebody else is not looking?
Yes.
And what got me into this is that, I have a passion for health. I have a passion for longevity, let's say for quality of life at the age that you're at. Mm-hmm. I think that's quite nice. And suddenly I found that dentistry fits into that.
Yes, it does. Because it's all connected, like you're saying, you should not separate it.
Yes, absolutely.
Especially like the microbiome in our mouth, and it's not disconnected with anything. And it's if we don't take care of our mouth at the root level, literally, the gums and the roots, and you're ignoring a good chunk of your whole body, right? Because it affects everything, the brain as well, I would imagine.
Yes. Yeah. And if you think of, if you live really healthy, how often do you go to the doctor?
Maybe once a year. Maybe
as a woman, potentially
once a year I would have
slightly more regular. As a man, the guy behind the camera, I think maybe I don't know when I saw the doctor last time. Because there's nothing that I exactly really need to see the doctor for. But how often do you see the dentist? Every 6 months, twice a year. You come from the US? Yes. So you guys love the hygienist, you guys love flossing, you guys love really to make sure the teeth are good. So you have every 6 months you go. Now, if you think of your dentist doesn't have an integration of general health, he could actually spot things that are not good for you.
Right.
He could spot that your teeth are not healthy and says, look, something needs to be addressed because your teeth are rotting away, your gums are not good. There could be either an effect on your systemic health or your systemic health might actually be affecting your teeth.
That makes sense. Yes.
And I think that awareness has to also come and play a bit.
Agreed. Yes. So, and having the wisdom to be able to notice other things happening and the education, because it is additional education that you have to go beyond your typical dentistry to become a biological dentist. But I do believe also, like you were saying, it should not be separated. Every single dentist should have this education because they could spot something a lot sooner because the patient is seeing them twice a year and the dentist could help really get ahead of something before maybe it gets worse. So, well, that's amazing. So then what about, we're very much into our health and our teeth in America. And, we floss, but not everybody too, but a lot of people in America too are just traditional dentistry. And so with biological dentistry, do you do additional screenings or, because we do have some biological dentists in America, but what is, when they come to see you, do you have additional things that you do on top of your regular visits?
So we like to suggest oral microbiome testing.
Okay.
We like to suggest where the patient's at, to see where the patient's at. But because we're looking a little bit further, we already, first I want to make sure the gums are fine.
Yes.
I want to make sure the fillings are fixed. I want to make sure that the margin of the crown, the margin means how the crown fits on the tooth, is clean. All of that part, all of these areas can actually have a bacteria.
Yes.
And then I think it's good to check the oral microbiome.
Okay.
And then to see pathologically if something's happening. The other additional screening, when you take a 2D X-ray, let's say for root canal, if you have a root canal, if you do the x-ray, you don't always see is the inflammation at the bottom or not.
Oh.
Because that inflammation might be not just at the bottom of the tooth, at the root, but it might be on the side.
Good
so
point.
You take the x-ray from there,
right?
You don't see this part.
No. Yikes.
Suddenly you take a 3D and then it opens up. And then you really see all of those little areas of inflammation. And we find so often that another dentist looked at the tooth and said it's absolutely fine. And you look at it, you think there's a slight shadow meaning, it's not as dense.
Okay.
And then you take the 3D and you see a huge, massive inflammation. Now, you definitely will agree that if you're very stressed, you might have an ulcer.
Yes.
There's also the knowledge that 60-70% of disc hernias are psychosomatic. So when we are stressed, we have pain, back pain. I have this from my own experience that it was just so stressful. My back was really in a knot.
Really tense.
At some point, the stress disappears and everything relaxes. So if we think of this, why would we not think that a dead tooth could have any health issues?
That's a good point.
If the mind has a health issue, why not something physical?
Yes.
And I think that's a communication that has to happen more often.
Education.
And it's not supposed to be a clash, but it's supposed to be communication with conventional dentists and the so-called biological dentists to really start to work together.
Yes.
And everybody here on the summit is really keen on that idea anyway.
Agreed. Yes.
And that's brilliant. You speak to like-minded people here.
Yes, we do. Yes, but it is more about educating all the dentists out there, but then and the general population too, so they can know that it is all connected and it's not a disconnected thing. Like when things are happening inside your body, it's not just like the dead tooth, but there's other things and other signals. So with root canals, is that something that you're able to help somebody, like, do you always have to go a root canal route, or is there a way that you don't have to do that?
The best route is if you come on time.
It's a good point.
If you come on time.
Yes.
But if the tooth is dead, you have to decide, do you do the root canal or do you take the tooth out? And it's a tough choice, and I think the patient has to understand all of the options and then decide. But when you think of health as it seems will benefit more if there's no dead tissue in the body.
Okay, that makes sense.
Because funny enough, we are the only ones that are leaving dead tissue in the system. The tooth, when it's healthy, has blood supply, nerve supply, lymphatic system.
Okay.
So it communicates. The teeth, you can feel really a slight difference in height.
Yes.
Teeth are very sensitive. Now suddenly you kill the nerve, that's a dead organ. We are the only ones that leave that in place.
Yikes.
And sometimes when you take the tooth out, it really smells. It's not a nice sight.
Yeah. Thankfully, I haven't had one.
It smells very much. Unfortunately, we can't show a picture now, but it looks
really bad.
Black, very black, very greenish, and gets all colors.
I'm sure that's not your favorite thing to see, but at the same time, you're helping them.
You help them.
That's
you help
true.
them.
Okay.
Now, you were saying, does it always need a root canal? There are ways to clean the tooth better with a laser, for example.
Okay.
There are ways to use materials that are helping for the nerve to hopefully recover. But when it's that close towards the nerve, the tooth will at some point say, you know what, I've had enough.
Yeah. Oh boy. Okay. And then what about wisdom teeth then? Was that something that you would say take out, leave, depends?
I would never say take out, take not out. That's wrong. It always depends.
Depends on the person, of course.
It depends on if the tooth is positioned like this, like that. Dominic had a question from the crowd, and it was exactly on wisdom teeth. And sometimes, patient comes to see me and says, Dominic said. But Dominic never said specifically on that one person.
That person, right.
But in general, he says, look, if it's like this, we suggest.
Okay.
But we have selective hearing.
It's true.
And with our selective hearing, we will hear Dominic said this, or Goran said this, or Ulrich Falk said this. We will just see something that we want
to see.
Now, if the tooth is completely impacted, sometimes it's so close to the nerve, don't touch it.
Okay.
If it's connected to the oral cavity so that you have food getting impacted, this can harm your number 7.
Okay.
So your number 7, if your oral hygiene is not great, may get this case. If that's the case, you lose 7 and 8.
Yikes.
So then it's really good if you actually get rid of 8.
Gotcha.
To save 7.
Okay. So make sure to see a good biological dentist to see.
Yeah. And it's not, we can make mistakes. We can have an image, we look at something, we see something today, 2 weeks later we check, we're like, no, actually this really has to come out. Because of getting to know the patient, seeing the situation better, checking the oral microbiome, see what's going on, check the eating habits, the cleaning habits, and then you say, look, you've got some time.
Okay.
Sometimes the wisdom teeth pushes through a bit further and further and further, and then you decide. But in the US, a lot of teenagers actually, in their teenage years between 16 and 18, they just rip it all out and say, let's just take it out.
They do.
But you don't even know if the tooth was going to come out nicely.
Yeah. It's protocol. Like as soon as it's 16, 17, 18, like, yep, time to take them out. And
yes.
Yeah, I have a 20-year-old and they keep telling her, yeah, it's time to take out, but I need to have her go to a biological dentist to really make sure.
So she didn't take them out yet?
No, not yet, because I told her to wait.
Yes.
But I should probably get a professional opinion.
Sometimes the gums are sitting half on top and that can create a bit of discomfort.
Okay.
We have nowadays kind of less space than we used to have.
Right, true.
Because our palate is not expanded enough.
Right.
Because we didn't breastfeed potentially, or the breastfeeding was not working, or there's a tongue tie. There are many issues that can happen. And then there's not enough space. And then suddenly the wisdom teeth don't have enough space to come
crowded. Through. Okay. Yeah. Even just like the way we eat too and what we eat, probably,
absolutely.
Right? And the way that the masseter bone and everything too.
Yes.
Yeah. Different world.
yes.
Than what everybody else was used to eating back then. But
okay,
so then what about flossing too? Is there there's like electronic flossers now? What are your thoughts on those?
So there's the water flosser.
Yeah.
When it comes to these things, flossing, I think everybody should really master the flossing with 2 fingers.
Okay.
Click,
traditional
that's
flossing.
It, traditional flossing.
It's the only way to really get it.
I think so, yes.
Okay.
But then there's nice materials that are less harmful. There's a great one from the US, it's called Super Teeth.
Okay.
They have a very nice floss. There are other brands that are here. There's a really cool brand, which is just over there. It's called Natch.
Oh, good.
I love those dental cleaning pastils, like little tablets.
Yes, I did hear about those.
The clean is so good.
Oh, good.
It just feels amazing.
I'll have to check those out.
Water flossers are good, but you try. You see if you like it. What's good is you take disclosure tablets. With a disclosure tablet, you can see if you cleaned your teeth properly.
Okay.
But, to be fair, you want to see the dental hygienist. She's going to guide you through all of that.
True.
She's going to explain to you how the cleaning works. And she might give you the tablets and see okay, you're really missing some areas. You have to do a little bit better in those parts.
That's a good point. Okay. That's a good one to give kids, right?
Yes,
when they're learning
absolutely.
how to.
Yeah, exactly. First let them brush, take the tablet, and then show them what they
Because it shows different color variations, right?
Yes,
okay. I need to I have an 8-year-old boy son.
Yes, yes.
I'm like, there's no way you brushed it that well.
Yes.
So I'll have to get some of those tablets.
30 seconds. Yes.
Literally.
Yes.
Okay. Yeah, I'm going to have to get some of those tablets too. Okay, so then I love to know also with everybody who comes by, just their own personal, either a biohack or supplement or just routine that you do personally in your day that's a non-negotiable. You're like, I have to take this or do this every day.
So a week ago, we did a little event with Barbara O'Neill.
Yeah, I love Barbara.
And I had the pleasure to meet her about 10 years ago. And then we connected really nicely. And then it came to the point that there was a week and she said, yes, let's do this. So we went to Serbia. And then in Serbia, she's telling us every single day what's important. And there was a TV interview. And in the interview, they were always asking, okay, what is good for beauty? And then she says, well, for beauty is such and such. Okay, do you put any creams on? She says, well, for beauty, it's important. Water, sufficient sleep, walking.
Yeah.
And again and again. And then she's really into cold plunging.
Right.
Into cold showers. And what's non-negotiable is you finish your shower cold. And you have, as soon as you wake up, you drink plenty amount of water.
A lot of water.
I mean, that's such a simple bio.
Right. It's easy.
Such a simple bio.
Free, pretty much.
It's free.
Yeah.
And I think what we should mostly go into is the free stuff.
Yeah.
What I really love is, I can't say it's non-negotiable, but there's one bed here. It's called Human Regenerator.
Okay.
I love that machine. It feels so good. So I used it a few times when flying.
Yeah.
You arrive somewhere, you're jet lagged, you lie down and your jet lag is just gone.
Amazing.
You jump up fully energized.
I will have to try that one.
But I have to say, I think we should all stick to the easy ones, to the simple ones, because that's what everybody can use at home.
So true. Yeah.
Everybody
Water, sleep,
can use cold water.
walking.
Everybody can drink enough, and everybody can walk enough, and exercise enough.
Exactly.
And everybody has the chance to sleep enough.
Focusing
and then if we live in London and things are different, then we use right water filters.
Right.
I like the red light glasses. They're great because we expose ourselves to blue light more than we did before.
Yep. Yeah,
and that throws our sleep off.
It does.
So what fits really well into biological dentistry is to make sure that everybody sleeps well. Everybody sleeps with the mouth shut.
That's a good point. So
tape.
Do you like the tape? Okay.
Yes. When you look at people sometimes listening, you see them going.
Yes.
They just drop the mouth open.
The oxygen is just Yeah, I finally do. I've been using tape probably for the past 2 years now, and I can't. I love it.
Okay.
But it does take a little bit of a learning curve at first. You're like, this is really weird. But is there a certain tape brand that you do like?
The Myo tape is great, but even just the simple one. Like a simple gentle
surgical
tape from there to there, surgical tape, clinical tape.
Okay.
Yeah,
so it doesn't have to be expensive. Yeah.
Exactly.
Okay, good. And then what about any maybe scam or just something that you shouldn't waste your money on, or
scam.
Either in dentistry or just in general? You're like, I don't know.
I'm going to look left and right and you'll catch me if I'm lying or not. Scam.
Yeah, or just something like, I've tried it, it's not really worth it.
Wow. You know what? I don't know. Measurables, wearables.
Okay.
It's not a scam. Sometimes I think, okay, when I wake up, I know how I slept.
True, right.
I know if I slept really well or not. If I now suddenly sleep with a ring or the Whoop, I'm not myself so much into all the precision measuring.
Right.
I just love to know that I've done my part.
Yes.
But I also know when I just don't feel the part.
The body will tell you.
I know when I'm too stressed that I don't sleep well. The body will tell you.
Yeah, very true.
So if you're trying to tune yourself into that a little bit better, I'm not saying that I'm, the best at it, but if you do, then this is almost something that you can leave out. But on the other hand, we love to see data. We love to see how we're doing. We love to see that, the red light is really helping and really working. I think that's also one thing that's amazing. One of those go-to things. And there's a brilliant podcast that I listen to with, I think his last name is, I think you say it Shell. It's very Robert Sehel. Shell. You guys can check it out. It talks about very simple guidelines.
Okay, good.
And he talks about light and red light.
Okay.
And it's brilliant.
Okay, good.
Those things are just
the little things,
so amazing.
right?
I mean, sunlight is number one.
Circadian rhythm. Yeah, exactly. Okay, and then what about something that you should definitely not do as a dentist? You tell your patients, never do this. Or have this toothpaste or
mouthwash. You should definitely not drink your Coke and brush your teeth right after.
Drink your what?
Drink your Coca-Cola.
Oh, Coca-Cola.
And brush your teeth right after.
Okay.
You should definitely not have anything super acidic and brush right after.
Okay.
That's when we create cavities from brushing.
Oh,
and when we brush very zealous.
Interesting. Okay.
And you should not buy a toothbrush with super hard bristles.
Gotcha.
And I think you should not go for any metals anymore.
Very true. Yeah.
Because the thing is, what's not right to say when somebody comes stressed and says, I had this done, I should have never done this. I believe that we all do kind of ethical work. We're trying to be ethical.
We are, yes.
And as a medical doctor, and I still think that I'm some sort of medical doctor.
Yes, you are.
Even though, we're dentists. Well, at university it was always, joked around, you're just dentists.
Yeah.
But funny enough that we are now seeming to be the central role for health. That's quite amazing.
Because it's all connected.
It's really connected.
I
it's really
completely
amazing.
agree. And thankfully, it's coming around.
It's coming out, and people are really talking about this. And actually, the people are calling for the change, and the dentists are very slow in applying the change.
Yeah.
Because we like comfort.
It's true.
And the client, the patient, he wants changes. So he's asking for it.
Yeah. They're like, no, I don't want to do this.
Your question before was, because I was going into something, I forgot where I was heading. You were asking me, I forgot. The wearables.
Yes.
Yes.
And the coarse bristles.
What not to do.
What not to do.
What not to do. And what else not to do is, we talk about the acidity. Metals, yes, that's where we went.
That's where we were, yep.
So really, don't touch any metals. Now we have options for non-metallic
fillings and
restorations.
Yes, okay.
So now that we have the option,
Thank
I
goodness.
think now I would almost say don't go for that.
Don't do it. Okay.
And I think that's almost one of the biggest no's.
Interesting.
So dental hygiene, yes, we care about, but it's not that important. What's important is what the dentist puts inside, and you really have options for non-metallic restorations.
That's
and
good.
then you should pick those, because metals can, do you know how many women have nickel allergies?
No. A lot.
Guess what, percentage-wise? Give it a guess.
50%.
Wow, okay.
I'm just
30.
Because you said it was going to be high.
Yeah,
so I'm
it's high. So 30%
but that is
very
high, though. Yeah.
If you look at a group of 90 women, 30 of them.
Yeah,
that's
not good.
Insane.
That's
So if you think of that, there can be trace metals of nickel in your metal restorations, which means you will have a chronic allergy towards that restoration.
That's not good at all. Yeah, that's horrible.
So
skip it.
Metals, skip it.
Skip it. Okay, that is good. All right. Well, Dr. Goran, tell me where people can find you, and like if they are here, obviously.
Yes.
And follow
London.
you.
Yeah. So you guys can follow me on Endo Clinic,
okay.
NDU Clinic.
Right.
My other Instagram is Dr. Gogi. That was my nickname.
Oh, I love it.
So my nickname was Gogi, so it just ended up to be Dr. Gogi.
That's fun.
And we are in London on Harley Street.
Okay, perfect. Yes. And then any other just words of wisdom or truth that you live by that you want to share with, or any hope that the audience?
Don't make me emotional.
I
think one of the biggest things is trust.
Yeah.
Yeah. And one of the biggest changes in life is psychosomatic. Mm-hmm. The trusting side is really where you create the connection. I think there's the blue zones.
Yes.
I think there's the blue zones. When you look into the blue zones, the biggest aspect is social side. And those blue zones, one of the biggest aspects is also the trust.
Yeah. Community.
I think that's what we're missing.
Right,
yeah.
Agreed.
Yeah.
In today's day and age. And
yes, absolutely.
Yeah, we're getting more and more digital, but more and more importance needs to be on
to ourselves.
Connection to ourselves and to people. So
yeah.
Oh, that's great. Good wisdom to share. Well, thank you so much, Dr. Goran, for coming on. And thank you, London. We'll be back tomorrow.